And this is exactly where the shift of thinking comes in. In this moment, more walking does not equal more healing. Better walking equals more healing. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Hi, everyone. I'm Michelle, and welcome back to the Total Knee Success Podcast. Today, we're tackling one of the most frequent and important questions after total knee replacement, a question that arises just hours after surgery, often before you've even taken your first steps. And that's, how much should you actually walk in those crucial early days? The answer often surprises people. At the end of this episode, you'll know how far to walk, how often to walk, how to judge your knee's tolerance, when to pull back, when to progress, and most importantly, how not to overdo it during the most vulnerable stage of your recovery. And just in case you were wondering, this podcast is for educational purposes only and is not a substitute for personalized medical advice. Before we get started, I want to remind you that you can check out the show notes or head over to totalkneesuccess.com to get ready for takeoff, your free 2-week knee replacement launch plan. And this is the plan I wish every patient had. It provides education on the last 2 weeks before surgery, so you can move forward with clarity and confidence. And it's yours free. Check it out. Now let's talk about walking. I want to take you inside a moment I've witnessed many times. You've just had your knee replaced. The physical therapist walks in and helps you sit up. And before you even have time to process what's happening, the question rises almost automatically. Wait, are we really walking already? It's a moment filled with curiosity, disbelief, and just a touch of overwhelm sometimes, often bubbling up even before your feet reach the floor. In that split second, it's easy to wonder how something so familiar could suddenly feel so unfamiliar. For most of your life, walking has been framed as one of the healthiest things you can do, so it's natural for your brain to grab that familiar script. If walking is good, more must be better. At the very same time, the experience of standing just hours after surgery feels completely different. Your body is processing something big, and you may not feel ready for much movement at all. Both of these reactions are normal and expected. Early walking does help your recovery, but only when it's matched to where your knee is in its initial healing phase. In those first hours and days, your knee benefits most from movement that is easy, intentional, and carefully measured. Right after knee replacement, the joint has been through a significant surgical intervention, and this is exactly where the shift of thinking comes in. In this moment, more walking does not equal more healing. Better walking equals more healing. And better walking means short, light, frequent bouts that give your knee exactly what it can tolerate: circulation, smooth joint movement, a little muscle activation without tipping it into the kind of overload that tends to fuel swelling. Many people don't realize that surgeons often prescribe very specific limits on early walking. Some recommend walking no more than 5 minutes every waking hour during the first week. In the second week, that guideline may increase to about 10 minutes every waking hour. These guidelines aren't about restraining your progress, they're about protecting it. In the early postoperative period, swelling can be incredibly limiting. It can limit your range of motion, delay your strengthening, change your gait pattern, and increase your pain. When swelling gets ahead of you, you risk losing ground, and that ground can be tougher to regain later. I've known patients whose surgeons set highly specific step caps, around 750 steps per day during the first week, and about 1,200 steps per day during the second. Those numbers can be surprising, especially for people who used to walk thousands of steps a day right before their surgery. But your preoperative walking capacity does not perfectly predict your postoperative tissue tolerance. The early phase of recovery is about healing, not conditioning. Your knee isn't ready for long walks. It's ready for short, protective walks. The research supports this thoughtful, measured approach to early activity. One of the clearest examples comes from a study led by Dandis and colleagues. They examined walking speed trajectories in the first days after surgery. And what they found was striking. Early walking speed had no meaningful relationship to functional performance a year later. People who walked slowly or for short distances early on didn't really end up behind. Their outcomes were essentially the same as those who progressed more rapidly. This suggests that you don't need to push your early walking pace to still achieve strong long-term outcomes. Another helpful study comes from Duong and colleagues who tracked step counts after knee replacement, and they found enormous variation. Some people exceeded their targets dramatically, often because they were pushing past their knee's tolerance, while others struggled to meet modest goals due to swelling and fatigue. The key message was clear. Higher early step counts were not associated with superior outcomes. In fact, pushing too hard early sometimes led to increased swelling or reduced adherence later on. This theme is reinforced again in a large systematic review by Orange and colleagues, which showed that functional recovery after knee replacement unfolds over months, not days. The early weeks are dominated by healing, swelling, and foundational neuromuscular recovery. Nothing you do can rush the biology. You can only support it with appropriate, measured activity. Minnick and colleagues also added helpful insight with their work on structured rehab guidelines. They found that when rehab was systematic and focused on quality and progression, not aggressive walking, patients had significantly better outcomes. Consistency, proper pacing, and gradual strengthening mattered more than accumulating steps. The research on misconceptions about movement also offers a useful parallel here. In their work, Bricka and colleagues examined why some people fear that exercise might be harmful to the knee, even though the evidence generally shows the opposite. While their study focused on osteoarthritis rather than postoperative recovery, the broader idea still applies. How we think about loading the knee shapes how we approach movement. What their findings highlight is that exercise is not inherently damaging. It's the dose that matters. Early walking after knee replacement follows this same principle. When the amount of walking matches what the knee healing can comfortably tolerate, it supports recovery. When the dose exceeds that tolerance, it can contribute to irritation and swelling instead. Appropriately dosed walking stimulates recovery. Overdosed walking fuels inflammation. Have I convinced you yet? Understanding these research findings helps you reframe early walking not as a test of endurance, but as a tool for healing. Walking is a way to prevent stiffness, wake up the quadriceps, and promote blood flow without creating excessive mechanical stress. Longer walking sessions do not accomplish these goals better than shorter ones. In fact, they often undermine these goals instead because they produce swelling, which interrupts all the processes we want to support, especially in those first couple of weeks. So, what does walking actually look like in the first week? On the day of surgery or the day after, you might walk a short distance with your therapist, often 20 to 50 feet, sometimes a bit more, but without pushing into discomfort. Although you probably will be having some discomfort either way. This is less about exercise and more about reawakening your neuromuscular system, safely maneuvering from one place to the other, and getting ready to go home. By the time you go home, usually on day 1 or 2, and it's most usually on day 1, you're taking short functional walks around your home. Walking to the bathroom, to the kitchen, or around the bedroom begins the pattern that your knee Walking to the bedroom, to the kitchen, or around the bedroom begins the pattern your knee needs, gentle, frequent exposure. As the days progress, those walks continue to be short. This is where that 5-minute per hour guideline really starts to make sense. 5 minutes is long enough to help the joint move more comfortably, promote circulation and reduce stiffness, but short enough to prevent swelling from building up. And that's pretty much 5 minutes every waking hour because you want to have movement and you want to have the walking to promote circulation and to help prevent postoperative complications, including blood clots. Now, as you move into the second week, swelling is still very much expected, and often quite noticeable. Functional mobility is still improving. The incision is still healing. The quadriceps are still recovering from what is essentially a neurological reset. It is during this time that surgeons often increase the walking recommendation time to about 10 minutes every waking hour. But even then, the principle remains unchanged. Short, frequent, controlled bouts of activity help your knee find its rhythm. Long walks, even if you feel good at the start, can often lead to increased swelling later in the day or the next day. Swelling is not a badge of honor. It's not a sign that you're making progress. It's a sign that your knee has exceeded its load tolerance. Excess swelling reduces both range of motion and muscle activation, making some progress harder, not easier. And while swelling at this stage is completely normal and expected, we want to avoid creating extra swelling on top of what your knee is already managing. Many people wonder when longer walks become appropriate. The truth is that your knee will tell you, usually somewhere between weeks 3 and 6. Something begins to shift. For many people, it's closer to week 6, sometimes even a little beyond, when the knee truly starts to feel more settled and the day-to-day swelling becomes easier to manage. Your strength improves. Your knee begins to trust itself, or rather, you begin to trust your knee more. And then 10 to 15-minute walks, done once or twice a day rather than hourly, become more comfortable. You're also just generally walking around more at this point. This is also when step counts naturally rise into the 1,500 to 2,500 range, or a little more for many people, even without intentionally chasing numbers. But even here, more is not automatically better. The point is not to reach 10,000 steps by week 4. The point is to walk a little more comfortably, a little more consistently, and with a little more strength behind each step. Really, a little more day by day. Not big leaps and bounds, but gradual progressions. Strengthening exercise play a much larger role in your progress during this later week stage than walking alone. We also have research that can help set expectations in a very down-to-earth way. In a telehealth study led by Daniel White and colleagues, adults with knee osteoarthritis, and this is not people fresh out of knee replacement, but still a group managing knee limitations, showed something really relatable. Step goals only work when they feel achievable. When the goals were set too high, people tended to check out. But when goals matched what they could reasonably do, they stuck with them. It's the same idea after knee replacement. Your knee has a limited capacity in the early weeks because it's healing, and that's completely normal. Setting walking expectations that match where your knee is, not where you wish it were in the grand scheme of things, doesn't hold you back. It actually supports steady, sustainable progress over time. And that's really the way our bodies work. Steady, sustainable progress over time. And throughout all these studies, a consistent message emerges. Early walking, not a race, not a metric of your effort or your toughness. It's a carefully dosed intervention designed to promote healing. Gradual, frequent walking is foundational. Long walking is optional a little later on, and not appropriate until your knee can really tolerate it without it flaring up and getting very swollen. And we haven't talked much about assistive devices yet, but they play an essential role in supporting this early walking pattern. Most people use a walker for the first couple of weeks after surgery, giving the knee the support it needs while healing and helping you avoid shifting too much weight onto the joint too frequently, just really in the early phase before it's ready. From there, many transition to a cane as their strength, balance, and confidence improve, and eventually moving to walking without any device, but only when it's appropriate for them, and this timeline is flexible, not fixed. Your body, your gait quality, and your comfort level determine when each transition should happen. Also discuss this with your therapist to make sure that your gait pattern is looking very good and symmetrical. So before we start wrapping things up, I want to talk to you about something many people experience in those first few weeks. They might feel anxious if their early walking seems limited. They look at their step counter and worry that they're not doing enough. They compare themselves with others who say that they walked several thousand steps during the first week. But comparison is not helpful here. Your knee is unique in its history, its surgical procedure, its tissue response, and your emotional context. Research shows clearly that early activity levels do not predict long-term outcomes. What predicts outcomes is consistency, adherence to appropriate guideline-based progression, and attention to swelling control. it does not matter what Mary walked in her first week after knee replacement. And we do not care how soon Joe went for a hike after surgery. Your progress is yours, and you are not Mary or Joe. And if your name is Mary or Joe, then I think that's just a coincidence. If you walk 5 minutes every hour during week 1, 10 minutes every hour during week 2, and keep your total daily steps near the surgeon's recommended limits, you are not falling behind. You are doing exactly what your knee needs through a delicate, vital phase of your recovery. Your long-term walking capacity will come. The best way to get there is to honor the early phase and let your knee heal. Does this mean sit in the recliner all day? Absolutely not. Frequent, short bouts of walking, period. Remember, healing isn't linear, and your progress isn't measured by perfection. It's measured by steady, thoughtful steps taken over time. You're doing the work, and your knee will meet you there. And remember, this podcast is for educational purposes only and is not a substitute for personalized medical advice. And in next week's episode, we're shifting gears to look at the preoperative side of the journey. The episode is called The Most Common Mistakes People Make Before Surgery and How to Avoid Them. If you're preparing for surgery or want to help someone who is, this one will give you the knowledge you need for clarity, direction, and confidence. This podcast is for educational purposes only. Discover more at totalkneesuccess.com and be sure to subscribe and share because every step forward takes you closer to living the life you love.